11:15, we will begin our session. Thank you so much for joining us today. Welcome to the first session of the PPCL ECHO program. My name is Jody West, and I will be the coordinator for today's ECHO session. I'm going to go over a few housekeeping items before we begin. First, please enter your name, title, organization, and email address in the chat box for attendance purposes. This is our agenda for today. We will do our best to adhere to this schedule. After I complete the housekeeping announcements, our facilitator, Dr. Olivier, will lead us in introductions, and then we'll pass to Elena Reguette, who will present our case for today. After she presents, we will open the floor to clarifying questions, first from the community participants and then from the hub team. Once all the questions are answered, we will transition to providing recommendations. Again, we will start with the participants and then hear any additional recommendations from the hub team. I will then briefly summarize all of the recommendations before we move into the didactic presentation from Dr. Olivier. After that, we will wrap up with announcements and close the session for today. Dr. Olivier.
Good morning, everybody, and thank you for joining us. I'm Dr. Christine Olivier. I'm a child and adolescent psychiatrist over here in Lafayette, Louisiana. I'm over here in private practice, and I am the facilitator for these sessions, which means I will be making sure that we stay on time. Jody, do you want to introduce yourself, your background and role?
Yes, thank you. I'm Jody West. I am a social worker, and I am the coordinator for the ECHO program and the provider-to-provider consultation line, which is a program that is focused on increasing access to mental health services for pediatric care providers and their patients.
Tanya?
Hi, my name is Tanya Williams. I'm the Healthcare Innovation Manager with Wellhead, Louisiana.
Lena?
Good morning, everybody. My name is Lena Reguette, and I'm a licensed clinical social worker. I'm with the provider-to-provider consultation line, and I'm also on the hub team providing IT support. And so my role with PPCL is that I provide mental health consultation to pediatric primary care providers.
Lisa?
Hi, I'm Lisa Spence. I'm a pediatric nurse practitioner with this specialty and also in mental health, and I work at St. Bernard Community Health Center, and I'm part of one of the team.
Right. I see a couple of hub spoke people that I'd like to introduce, or I'd like them to introduce themselves. There's a Keisha on.
Hi, my name is Keisha Benoit. I'm a licensed clinical social worker for the Lafayette Parish Health Unit in CSHS.
Awesome, welcome. What about Brandy Dillon?
Hello, good afternoon, everyone. I'm Brandy Dillon. I'm a social worker here at the Student-Based Health Center. We are based on Northside High School's campus. Thank you.
Awesome, welcome, Brandy. We also have Paulette Carter on.
My name is Paulette Carter. I'm a social worker by profession, but I'm also a program manager at the Bureau of Family Health, which is under the Louisiana Department of Health, Office of Public Health.
Awesome. Lauren Foti. Lauren, you there?
Hey, can you hear me?
Yep.
I'm Lauren Foti. I'm the CSHS RN supervisor here at the Lafayette Parish Health Unit.
All right, and Sienna.
Good morning. I'm a social worker and also the resource specialist for PPCL.
Welcome. And I just saw Dr. Queen join. Dr. Queen, do you want to tell us where you're zooming in from?
Sure. I'm a general pediatrician, also board certified in obesity medicine. I'm with Our Lady of the Lake Children's Health, and I'm zooming in from Covington, Louisiana.
Awesome. Welcome. I think that's everybody on the call at the moment. So I'm going to pass this over to Lena.
So now we'll move on to the didactic presentation. I will advance the slides for Dr. Olivier. We're going to go ahead and start recording again. And any questions that come along, you can put it in the chat and we'll address them at the end. So Dr. Olivier, you can begin when you're ready.
Okay, so I finally get to explain to you guys what is ECHO. You'll see that we started the session with a case, And then the didactic part is the second part of this session. And so today we're just going to talk about what is the ECHO program, what's the model. So a little bit of background. I found the background story very interesting, and it kind of stuck with me. And so when you're describing this to other providers or to friends and family, this is kind of what you'll think about. It started with Dr. Sanjeev Arora was the name of the physician that started ECHO. He was a gastroenterologist working in New Mexico, and New Mexico, like Louisiana, is a very rural state. And there's most of the medical specialties tend to hover and congregate in the metropolitan areas like Santa Fe. Being a GI specialist, Dr. Arora is trained to treat hepatitis C, which is a condition that is 70 to 80% survivable if treated. And what Dr. Arora was noticing and what he found was that patients were waiting to see him and traveling from so far away to see him. And his waiting list was getting up to 8 months, even up to a year long before these patients with hepatitis C could initiate treatment. He found that a lot of the rural primary providers were not comfortable treating the condition. And some patients died waiting to see him. And so he got to thinking, this was 20 years ago, that there's got to be a better way. You know, we all were providers, we all were trained, we went through intense training in our medical subspecialties. Why aren't we competent to take on, you know, these specific cases and diagnoses? So he created the ECHO model so that more providers could feel comfortable treating hepatitis C and that more patients could be saved. And then by creating more providers that were specialists in certain things, he was able to virtually eliminate the wait time for a patient from when they were diagnosed with hepatitis C to start treatment. And so that's where it began. What does ECHO stand for? So ECHO, it stands for Extension for Community Healthcare Outcomes. And it's a movement to demonopolize knowledge and amplify the capacity to provide the best care for underserved people all over the world. The model connects primary care providers and specialists on a live virtual platform, like we're using now, Zoom, to share knowledge and expand treatment capacity in rural communities. So Dr. Arora got to thinking, how do you create a specialist? You know, we went through years, I went through residency, fellowship training, but how did we learn in our respective trainings? We saw patients, we discussed cases with attendings or supervisors or mentors. We attended grand rounds and didactics. And so these ECHO sessions strive to combine all that into one succinct session every month. And so that you over time become more comfortable treating specialized cases and become your own expert at treating specialized cases. So it's a one-stop shop monthly session. How is ECHO different from telemedicine, from traditional telemedicine? Well, telemedicine is a one provider to one patient type of model, whereas TeleECHO aims to use experts to train other providers to be experts. So it's a provider to provider model, and it's a small group of providers to a larger number of providers. And so the idea is to increase the capacity to treat patients and not just not just adding one provider to one patient model. So the idea also is that the treating physician retains the responsibility for managing the patient. So that patient, where if you send them by telemedicine, they're seeing another provider from miles away, even possibly out of state, whereas the idea is to have these patients to be able to see their providers closer to their home and not have to travel, not have to see them in a different state. So there's ABCs of the ECHO model. The A is for amplification. So we use technology to leverage scarce resources. So the technology we use is Zoom. It is a HIPAA compliant Zoom-based platform. The model of one to many providers allows us to leverage scarce resources. So there's only 92 child and adolescent psychiatrists in the state of Louisiana. So it's a way of having our few specialists reach many providers. We are able to reach learners in more rural and underserved areas to provide access to knowledge and best practices. And that's what differentiates ECHO model from telemedicine again. The B is for best practices. So we are sharing evidence-based practices to reduce healthcare disparities. Best practices improve the quality of care and services. This principle of the ECHO model provides a fast and efficient means to disseminate the most current information. So again, you're not waiting to take a course a year down the road. We're doing this active real-time monthly meetings. C is for case-based learning, because again, the way we learned our medical knowledge is through cases. It's through that interactional component of medicine, seeing cases, seeing patients, and learning from them. And the idea is that we share this all with each other, and I'm learning as an expert as I'm teaching, and you're teaching me as the Spoke Hub experts out in your rural communities are teaching us as well. Real world situations are shared amongst the network. This creates a learning loop with extensive knowledge is imparted, skills are taught, and self-efficacy is encouraged. You're learning from other community-based providers' experience and knowledge, and that creates a community of practice. And we share case management making decisions. So this is shared knowledge. And then finally, the D is database to monitor outcomes. So ECHO itself is an evidence-based medicine, evidence-based idea and model. So we are using software to track outcomes. We are going to ask for active real-time feedback after each session, which is very important because we want this to be valuable to your time. We want this to get better as we go. So why does this work? Why does this model work? So you're taking technology and you're multiplying knowledge. You're demonopolizing knowledge. So you're having one or a few experts share their knowledge with multiple people. And it's this all teach, all learn method. So you're moving knowledge, you're not moving the people. You don't have to go travel to a conference to learn these things. You don't have to go back to medical school or nursing school or social work school. This is removing the knowledge and bringing it right to you at your convenience. So how do we use ECHO? So ECHO is not brand new. It might be brand new to pediatric behavioral health in Louisiana, but it is not new to the nation. We use it for prevention, we use it for screening, and we use it for treatment. So in Dr. Aurora's original case, he was using it to treat hepatitis C. But now we've learned that this works in many different ways. From screening for cancers, this works in prevention, smoking cessation campaigns. So there's many different ways this ECHO model can be used. And then where it's used, as I said, it is used all over the nation. ECHO's been around for a long time. You can see Louisiana's kind of scarce, and we're going to boost those numbers and get our blue painted on the map as we go. But they were previously using ECHO in the state of Louisiana with internal medicine docs and for other diagnoses and treatment of other illnesses and disorders. You can see New Mexico is covered. So originally it was started in New Mexico. And also what I didn't show in this slide is that the ECHO model is a global thing now. They're using it in multiple countries. And so it's not just unique to the United States anymore. That is being used worldwide to disseminate knowledge and create more specialists and providers. So what are the benefits of ECHO? A lot of it is self-explanatory. For the patient, they get the right care at the right place and the right time. They don't have to leave home. They can go to their local providers. For the provider, you acquire new knowledge. You have the capacity to treat more patients with disorders you might not have been comfortable treating, and you get to build a community of practice. So now I know I get to interact with Brandy over at Northside High, and and Dr. Queen over in Baton Rouge, and so it's nice to have this network of providers. For the community, it reduces healthcare disparities. Thanks for the heart, Brandy. It helps to retain providers because they feel more competent. There's less burnout. It also, so important, it keeps patients local. Patients don't have to travel from Shreveport 3 hours to come see Dr. Olivier in Lafayette. There's a provider up there who's comfortable with pediatric behavioral disorders. And again, for the bigger healthcare system, it increases access, improves quality, and reduces the costs, the ultimate costs of these disorders and illnesses that we're trying to treat. So for the next few minutes, I'm going to review the basic ECHO session structure. You've kind of had an introduction to it already as we've gone through it. So you've kind of seen it in action. But the session structure, we call them the TeleECHO sessions or just the ECHO sessions. These are regularly scheduled video conferencing sessions. For our sake, they're going to occur monthly, which include subject matter experts, which was your hub team that we introduced, and I'll reintroduce through the slides, and learners who use the ECHO model. So in each session, you'll get a brief lecture. It's usually about 15 to 20 minutes. So it's not those long, hour-long grand rounds or conference presentations, which I like about ECHO. And case-based learning, which is so important. So the actual real life cases, and these create learning loops. You're learning our spoke team is learning from the experts are learning from the spoke team. So we got a learning loop going and sharing knowledge between all of us. And so these sessions are the core feature of the ECHO model. The next slide, so again, this is just a slide to remember that we're maintaining fidelity to the model. The ECHO model itself is evidence-based, so the sessions are very highly structured. We are very, which is why my role as facilitator is to make sure we stay on time and cover everything we want to, because we are following an evidence-based model. See. So PPCL, what is PPCL? That's the provider to provider consultation line. That's what we're calling it in Louisiana. And so the name of the pediatric behavioral health component of this is the Well Ahead Louisiana and provider to provider consultation line will serve as the hub of specialists. So we have a psychiatrist, myself. We'll have 1 or 2 nurse practitioners, that's Lisa, and 2 social workers, which are Jody and Lena, on the hub specialist team. We will have some providers that will come in as specialists just to do the didactic portion and to participate in sessions down the road. So just so you know, there are a few other members that you'll see along the way over the next 6 months. All the clinicians in the community who work with pediatric patients are invited. Social workers, pediatricians, nurse practitioners, physician assistants, nurses, all of them are invited to come. The focus, though, is on rural primary care providers, especially at rural health clinics. Beginning next month, we will start the sessions. They'll be held every second Tuesday from 11:15 to 12:15. They will start with a case presentation. There'll be 15, 20-minute didactic, and then we'll wrap up. CEUs, free CEUs and CMEs are available to physicians, nurses, and social workers. So I thought that was a great part of ECHO. You get free CEUs. So again, there's 4 basic ECHO roles, and a lot of these roles overlap. So we have a facilitator, which is me, that makes sure we stay on time and make sure our sessions stay structured. We have the program coordinator, which is Jody West. She introduced herself earlier, who is the lead on this project and gets everything together behind the scenes. We do have our subject matter experts, which is all of us actually, me, Lena, Jody, and Lisa, and Tanya too. And then we have our IT support staff. So they make sure that if we have any Zoom troubleshooting issues, we do have IT support on with us. And so they're in the background keeping things running if we have any problems. And again, this is just a slide for reference of who's the basic hub team members. So I want to pause just because to reiterate how important the case presentations are. We really, really encourage our spoke sites to present cases because we want real life, real experiences. So if you have a pediatric behavioral health case where you weren't sure what to do or what the most up-to-date treatment is, or if you made some recommendations and are unsure if it was the right decision or not, bring it to us. I encourage you to present the case. We're a very laid back team, and we were all clinicians. We are all clinicians, so we know we've all had those cases that raised our eyebrows that we know it was better to shoot it around with our mentors or our friends or therapists in my building, and those sorts of things. So we want you to bring those cases, and we encourage our spoke sites to present cases. And then at the end of the session, there will be an evaluation that goes out. We encourage you to be honest because, again, we want this to be worth your while. We want this to be worth your time. We want to continue to improve week to week, month to month. So please take the evaluation seriously and complete it. All right, I will open this up I hope that gives you kind of an introduction to what the ECHO program is, what we're about. And so I'll open up to any questions about ECHO.
Hey, Dr. Olivier, thank you so much for that. I've done several echoes through AAP, but I really didn't know the background, so that was kind of interesting. Thank you for sharing that. I was wondering, so when is the provider-to-provider consultation line officially open? For example, I work in Bogalusa, which is rural pediatric clinic. I have 2 other pediatricians who are not signed up for this TeleECHO. I think they missed the deadline for whatever reason, but can they still call into that provider-to-provider consultation line?
So the provider-to-provider consultation line is not live yet. We hope to be live within the next 2 weeks or so, because we are lining up our psychiatric coverage. We do have coverage with social workers and resource specialists, but we do not have, if a provider, a physician or a nurse practitioner wants to call asking for guidance about medication management, that part of our program is not available yet. So we haven't officially gone live with the PPCL line yet, but we wanted to go ahead and launch the ECHO. So even though the deadline, we asked folks to sign up by October 4th, they can go ahead and still sign up for this ECHO. And our next session is November 8th, and we're going to focus on very specific topics moving forward. So they could still sign up for the ECHO. They can register for the PPCL line access. And once we go live, we are going to send an email out to all of the folks that have signed up for PPCL consultation line to let them know that we are active with the phone number, with the email address. So that way we can start receiving consultation calls.
Yeah, and just to reiterate, we're really pushing hard on getting some contracts in place so that we can launch this in the next couple weeks. So we will be sending out notification to everyone as soon as it's launched, and it will be as soon as it's live, we will have all the support that everybody needs and wants through the PPCL line. So.
Any other questions about ECHO, the ECHO model, or get your colleagues to sign up? I did. So originally, when we met last month, I had the question, can I share like the PPCL stuff on Facebook and stuff to kind of advertise? And the answer is yes. We want the more providers, the better. So that's another way if you want to recruit.
And the case presentations, the case presentation that Lena presented today are, as you can see from the slides that Dr. Olivier went over, it's such an important part because we all have those clients or those families that it's just, there's something more. We want input, we want feedback. That pediatrician for that family was concerned because the family had left their other pediatrician, and the pediatrician didn't have any background information. And it went from no concerns to all these concerns. And so the pediatrician reached out for a consultation because of concerns about, is this what's really going on? Is this a true picture of what the child is able to do? There was a lot of questions about what's next for me and how do I build a relationship quickly with the family that has a high need, that has a child that they're presenting as having a high level of need. So whether it's a consultation you're seeking or about a case you have or someone you're working with, the case presentations are a really vital part of just getting feedback. And again, we send a summary to you with our recommendations once the session is over. So that way you can pick what suits you best and what you feel the most comfortable with and what makes the most sense to move forward with caring for that patient, that client. So we're going to put a link in the chat to sign up. I know Dr. Queen's already signed up for a future presentation. Thank you very much for doing that. But we have open spots for next November, or for the next few, for November, December. So we'll put the link in the chat to sign up for it, and we'll remind you and work with you for the information if you have questions about the case presentations. But that is a very important part of the process. Any other questions about ECHO or about PPCL?
I'm sorry, I have all the questions, I guess. So I have used the 2-lane LAMP provider consultation line for early childhood pediatrics questions or behavioral health questions. I don't know if that's actually called LAMP. Anyways, there's a 2-lane one. Y'all probably know what I'm talking about. E-Tech, I think it's called. So is that different? Are you guys going to have a cutoff of a certain age, or are we going to cover all the way down to birth in this ECHO or in this PP? You know what I'm saying? I don't know all the acronyms.
Yeah, PPCL is, you're talking about TECH, so 2-lane Early Childhood Collaborative, and that's a great program. Works with early childhood. LAMP is another one that focuses on perinatal and pregnant persons and their mental health needs. PPCL, we're all sister programs. We all do similar services, but PPCL is going to focus on pediatric, which is considered 0 to 21. So that's the age range that we are, and we're covering statewide. And so it doesn't matter where the provider is or where the patient is. PPCL can provide access or provide recommendations and linkage for pediatric patients 0 to 21.
Yeah, and just to reiterate, PPCL is statewide, so any provider across the state can call and can access PPCL, and it's all sort of via telephone and email consultation. So it's all sort of kind of virtual platforms for consultation. And again, just to say, it's birth to 21. So yeah, anybody you're working with within that age group, and it can be patient-specific consultation, but it also can be not patient-specific. So if you just have a general question around screening or something else that you encounter in your practice that isn't specifically related to a patient, please feel free to call. As soon as we get, we're excited to get rolling with the program, and we'll get it going as soon as we possibly can.
If there are no more questions, or please ask if there are questions. If you would make sure that you enter in your attendance, please. Information for attendance. Lena is going to put a link to the survey for your CEUs or CMEs, and we'll also send an email with that link. You have 48 hours to complete it, so please don't sit on it. Go ahead and fill it out, and a certificate will be given. It's as soon as you submit your questions, you'll have the access to the certificate to download and print yourself. So it won't come from us. But again, you'll have 48 hours from the end of the session to complete that survey link. Our next session will be on November 8th, same time, 11:15 to 12:15. The focus is going to be on screening for anxiety disorders in pediatric patients, and Dr. Olivier will present on that content. If you have any questions before then, reach out to us. Our email is ppcl@la.gov. We did extend the registration for the rest of the ECHO series. We have 5 sessions left. So if you have anyone interested, please just direct them to the registration or let me know and I can send them the registration information. There's also requests again for people to sign up to present a case. That way we can work on getting the form uploaded into our presentation and removing any PHI before the next session. And we have our website, ldh.la.gov, PPCL, so that way you can find out more information, but I should have sent that information to all the participants. Again, just one more call for any questions that anyone may have. If you don't have any questions, we hope to see you in November, and thank you so much for joining us today.